Welcome everyone to No Romance Without Finance. Today our guest is Stephanie Wolff. She is the nation's leading sexual wellness expert, the co-founder of Launch Medical, co-inventor of the Phoenix, a board-certified sexual wellness specialist. She's a hormone expert, a peptide expert with the American Academy of Sexual Wellness Specialists, a board-certified physician's assistant, and a certified weight loss specialist with the National Academy of Sports Medicine. Wow, that's a lot of credentials.
Yes. I feel like we should just erase all that. That's not true.
Amazing. And she graduated from Arizona State University in 2000 with her Bachelor of Science in Life Sciences and continued on to Midwestern University, where she obtained her degree as a physician's assistant in 2003. Stephanie has been practicing medicine for over 20 years. She has worked in everything from cosmetic surgery, dermatology, to women's health and family practice. Stephanie has helped countless patients reach their health goals, regularly treats and corrects sexual health issues and hormonal imbalances. And over the years, Stephanie's active lifestyle and commitment to her and her family's health have naturally flowed into her practice of medicine. She truly believes in healing her patients from inside and out. Stephanie, welcome to the podcast.
Oh, thank you so much for having me. Gosh, that's a mouthful. I didn't even know.
You're a truly accomplished woman. And you know what? I am going to give you all the praises, because men give themselves praises. They don't care. They're like, yeah, keep reading about all my accomplishments. But we women are just a little bit more shy, and I'm just going to let you shine because you deserve it, woman. So
Thank you.
I want to get into something that is affecting women all over the world, things that we really don't talk about. And actually, I'm going through right now. And it's hormones. Okay.
Yes.
So, some of our listeners may be younger listeners, but listen, people, this is coming. If you're a woman, it's inevitable that your hormones are going to change, and you're going to start menopause. And just to share my story, which is just so weird because this recently happened to me, where, I am 51 years old. And every time I go to the gynecologist, they're like, oh my gosh, you have so many follicles, you got a ways to go until you get to menopause. So I'm thinking, oh, that's down the line. And my menstrual cycle is just like that, like to the day, clockwork. Okay. And about, I would say 3 months ago, I started noticing a little change in my menstrual cycle. Like I would have a small one in between where I really wasn't supposed to. And then when I did have my cycle, it was just weird. It was like, again, I don't want to get too graphic, but stuff happening that hadn't happened before. And all of a sudden I'm getting like this severe cramping. And then I feel like, oh my gosh, the world is coming to an end. I was so depressed, Stephanie. Like I was on the couch, like crawled up in a ball with a blanket covered over my head, being like, I don't want to live anymore, which is so unlike me because I'm usually like so upbeat and so happy, And I started to get hot flashes. And at first, I didn't know what the hell these things were. Like I'm familiar with hot flashes because I had endometriosis, and I had surgery for endometriosis twice. So after you have surgery, they put you in menopause for 6 months so you don't menstruate, right? So I knew what the hot flashes were like, but that was like 30 years ago. So all of a sudden I'm sitting here, in a client meeting, and I'm like sweating. I'm like, oh my God. And I realized I'm like, this is hot flashes. So then I'm like, oh my goodness, I think I'm going through menopause and it is affecting my life. So before I talk about what I did about it, since you're an expert in this field, can you tell us how hormones and hormonal imbalances affect women in our lives?
Yes. Yeah. And it's so funny because I just saw a woman right before, we started this podcast. She was a new patient. She's 50 years old, same thing, all the same symptoms that you talked about. And, The one thing that I always try to explain to you guys is that both men and women go through menopause. That, I think,
Really?
nobody understands that. Yes.
Huh.
Men go through it just as much as women do with the exact same symptoms. They're having hot flashes, night sweats, fatigue, brain fog. It's just the difference between the two of us is men start going through it around age 30, 35, and it's this very slow decline. So they start saying, well, I didn't get a good night's sleep, I didn't exercise, I drank too much alcohol, I'm stressed at work. They start making excuses for why it is the way they feel that they feel.
Wow.
Whereas women, we know that once we stop menstruating or we start having irregular menstruations, we already know that that's part of menopause. That's coming for us.
Sure.
So I always explain it this way, that men have a slow, gradual decline. We go to bed and we wake up the next morning and bam, we're in menopause. So that's the difference.
That's what happened to me.
us.
That's what happened.
Yes.
I'm not in menopause yet, but that's what happened to me. I was like, one day I was fine, and the next day, boom.
Yes. And, something that I always tell women and men is that we are very different, believe it or not. Women are a little bit more intricate than men. Men are kind of basic, sorry. But for us, the way I like to think about it is it's a teeter-totter. So you have estrogen on one side, progesterone on the other, and you have testosterone in the middle. And this teeter-totter needs to always be balanced in order for us to feel and do what we do best.
Right.
And the minute that this teeter-totter becomes unbalanced, such as endometriosis, so now you're estrogen excess, or maybe you just gave birth, now you're progesterone deficient, whatever is going on in your world, those imbalances and that teeter-totter is what's going to create these symptoms. And so, it may be, like you said, it's this hot flash where you actually feel like there's an oven inside of you that's like baking your organs.
Right. Right. Yes.
That's going to be estrogen. Something else that, I'll commonly say to women, and if you haven't experienced this yet, this is fantastic, but this is also part of it. You'll start having a very dry, scratchy, itchy vagina where it kind of feels like you have these like hot ants, like red ants in your vagina.
Yes.
That is menopause, so it's real. It's coming for us. Do we actually need to do that? No, we don't. And so, I'm here to kind of be this advocate to ladies that you don't have to live the rest of your life like this. If you actually think about it, back in the olden days, we would have children, age 13, 14, right? When we menstruated. And then most of the time we were passing away in our 60s.
Right.
Well, modern medicine has now kept us alive until we're 80, 85, 90. We're seeing a lot of, 100-year-old patients. And the reality of it all is that we're living in this dead body for almost 50 years of our lives.
Right.
So we're only getting half of our life with hormones to be productive or as productive as we possibly can be. And it's unfair because this is the time that we're supposed to get our career and we're supposed to have a family and we're supposed to do all this for everybody else. And then the second part of life is when it's finally our turn to be something for us in this dead body that doesn't work. It makes no sense. So, I don't know about you, but I want to live like the fullest life possible in my next life.
Absolutely.
And what that means to me is like, I want good sleep. I want good sex. I want my skin to be good. I want my hair to be good. I want to have energy. I want, my mood to be working. And so, and all of that is hormones. Estrogen does a lot of that. Estrogen is, preventing cardiovascular disease. It prevents diabetes, blood pressure. It helps prevent dementia. It helps with your skin, your collagen, your vagina,
right.
And then progesterone does kind of the opposite side of that, or, balances that, where it's going to release your GABA, which is an anti-anxiety, antidepressant. It releases melatonin, helps you sleep at night. It helps with hair growth. It helps with your immune system, helps with your bones, helps with your vagina. And then testosterone is mental clarity, mental focus. So I can't tell you how many women come into my practice and they'll, they're in these high position roles and they go, my brain doesn't work. I can't find the words I'm looking for. Right. And that's testosterone deficiency. Believe it or not, women need testosterone just as much as men do. Right. We don't need as much as they do, but we need it. That's what's giving us that mental clarity. So it is a combination of all three that kind of keeps us moving forward. And I think it's so important that these women understand that they do have options and that you don't have to live in this dead body for 50 years.
So when do you
Please don't.
see, right? So when do you see, or when is the decline of these hormones in a woman's body? And by the way, before we get into that, I am just shocked when you said that men go through menopause as well, but much
Yes.
earlier. And you said, it starts at 35. I'm just wondering if that has any connection to the midlife crisis that men go through at the age of 40, 35,
Totally
40.
agree with
Do you
that.
think there's a connection there?
I do. Yes,
Okay.
absolutely. And they don't understand it because nobody talks about it.
Right.
So they feel lost. You know,
Right.
they don't know why they feel the way they feel. And every doctor they go see just wants to put them on antidepressants, anti-anxiety, telling them they have ADD, they have insomnia, and it's just kind of like, I just wish everyone would talk about it.
Right.
It's like our hormones, these are the chemicals that actually make our engine work. That's what we are. We're an engine.
Right.
And it's no different than, we have to put gas in our gas tank every day to go somewhere, or we
Right.
have to get our oil changed or put windshield wiper fluid.
Sure.
And we all do that. We all take care of our car because we know our car is going to take us from point A to point B. But we don't do that to our bodies.
Right.
And it's like our bodies does so much more than driving us from point A to point B.
Absolutely.
You know?
So back to my question, when do these hormones start declining in women generally? I know everyone's different, but when do they start?
Yeah, typically it's about, I would say, age 30.
What?
It's about 30 to 35. Yes.
What? Wow.
Yes. And what happens first is your progesterone starts to decline. That's the first thing that goes.
Interesting.
Which is why most of these women have a difficult time getting pregnant. Think about it. Most women are trying to get pregnant in their late 30s, early 40s.
Right.
And you need progesterone to carry that baby to full term. So progesterone's the first thing that starts to decline.
Okay.
From there, then it's the testosterone. So that's where they start no energy, brain fog. Estrogen is the very last thing that takes a plummet. And when that estrogen drops is when we no longer have a menstrual cycle.
I see.
So that's the last stage.
Okay.
So think about it like that. You've gone through this whole time period of decline, and it isn't until that one day that you go to bed and you wake up and you're like, oh, I think this is what's happening to me.
Right. And that's what happened with
whereas
me.
men don't have the menstruation. Exactly.
Yeah. Yeah.
And then think about pregnancy for a second. When you're pregnant, you have the most estrogen and progesterone because obviously that's what's holding the baby and carrying it.
Right.
And then when you deliver that baby, you just basically ripped out all your estrogen and progesterone, which is why most women will feel postpartum depression. You just completely got rid of all your hormones, all these feel-good hormones while you were carrying the baby. And it takes a while for your body to adjust and adapt and go back to the way it was.
And at what point?
It's unfortunate.
And at what point then, if we're seeing a decline at the age of 30, 35, right? At what point should we be considering taking hormones or taking something for this? Like, where does that, like, how do we know when to start?
So I was thinking about this a couple months ago, and I said, wouldn't it be great if we could start this movement with young people? And I mean like in your 20s.
Okay.
And I say, when you feel your best, when you have energy and your brain works and you're sleeping and your sex life is great, I want to know what your hormone levels are right then and there. I want to know what those optimum levels are so that when you do start making the change and you're going through it, I can then reflect back and I say, well, I remember you felt good at this level. So at least I have a baseline of, okay, where do I want to at least try to get you to now that you're coming to me in menopause? Because that's the other thing, everybody's different. So I'll have a lady who feels good with her hormones at the lowest level. You get her just, a couple points above and she's feeling all kinds of symptoms. And then I have the same lady who's the same height, same weight, same everything. She feels good if she's on the higher side with her hormones. She's functioning. So everybody's different. And men are the same way. And it really just takes us communicating so that I understand where that level finally is. But wouldn't it be great if I had a baseline to know what that looked like? So I really do encourage young women to get tested. And here's the other thing. There's so much resistance behind getting hormones tested in the primary care and your OBGYN.
Yes.
You just got to be adamant. You got to request it. You got to walk in there and be like, this is my health. I want to have these tests done and get them done, because then you can take a look. You have them in your back pocket and you say, okay, this is when I felt my best. So that when the change happens, you pull those labs out and you're like, this is where it was,
So when you say getting your hormones tested, I know a lot of people and their primary care or their OBGYN says, there really is not an accurate way of testing your hormones. Is that correct? Because it seems like that's not where you're going.
Not at all.
Okay.
And it really just depends on who you see, and everybody's different. There's some doctors who prefer blood, some prefer urine, some prefer saliva. So there are different ways of testing your hormone. It just depends on what they're comfortable with and how they treat you. There's no wrong or right way about it. Everybody's different.
Right.
But, there is a way to test it. And so that's just false, completely false.
And you said there's a way to test it. So is it, you can test it at any time? Does it have to be maybe 3 days after your cycle? When is the best time?
Yes. Yep. So if you're actually trying to get pregnant, so this is where I think the disconnect comes in. Most women, they'll go see their OBGYN because they're trying to get pregnant and they can't, and they've tried for the last year. So those doctors are going to see, okay, well, what is your fertility? What is your ovarian, function? That is a specific day. That's going to be day 3.
Right.
But if we're looking for, what are your cycles doing when they're at their kind of like highest, when they're all supposed to be communicating together, they typically say it's day 18 to 22 if you're a 28-day cycle. Okay. So I always try to tell patients, if you're not 28-day, you're 30-day, 31, 32, it's 7 days prior. So 7 days prior to your menstrual cycle is when you really want to get those labs checked on that day, because that is going to kind of show you the whole symphony behind your hormone panel.
Interesting. Very interesting. Okay. And you say that that's accurate, right? I mean, the results that you're getting is accurate.
Yeah, it is. Yeah. And it's really interesting to kind of see, when I see a patient first, I'll go through their whole health history. I ask them lots of questions, personal questions. And the questions I designed to give me answers to help me understand where it is that they're lacking. Right. And so as we're going through all these questions and answers, I've already kind of created this in my mind of, okay, she said this, she said that, this is what she's deficient in. And then, going into the blood work, you actually see it. Right. Like is black and white showing you exactly what she said. And so once you kind of make that correlation, you show that to her, she's just like, the world just opened up to her. And, to me, what's fun, I'm a numbers person. I've always been into math. Math was like my favorite in high school. And so to me, it's all math equation. And once I kind of see them in follow-up a couple months later, it's comparing comparing numbers to numbers, apples to apples. Sure. It's like, you can finally kind of see, this is where you were when you came to see me. This is where you are 3 months from now, 6 months from now, 9 months. And then, based on your goals when I first saw you, as opposed to how you're feeling now, things change, So sure. Let's say a woman comes and sees me for the first time, her main goal was just brain fog, or fatigue. She just wants to be able to make it throughout the day. And then I see her 3 months from now and she's like, I got energy. This is great. Okay, now I'd like to focus on, I don't know, my libido or my skin. So it's like, it starts to change and mold, as things start to improve. It's like you start kind of like digging in there. What else can I be doing? Right. What else can I, adjust and change? So it's fun. I truly enjoy what I do.
It sounds like it. It sounds like, because you enjoy what you do, you provide really good information to these women that are coming to see you. And you were saying that as it changes, does your approach change? So let's say someone comes in and they have a hormonal imbalance. What do you do?
Yeah, it's all about their goals. Okay. So that's the big thing is, this isn't about me and pleasing me. Sure. I'm not the one that's going to go home and do your regimen for you. Right. So I want to hear what it is that you're worried about today. Like, what is your number one issue? Okay, well, your number one issue is this. Well, let's fix that first. Then let's get you kind of focused. And where's number two? So to me, medicine is not a one size fits all.
Sure.
I've never believed in that. And everybody is unique and different because we're humans. We all tick just a little bit different. So kind of what I was saying is, you might need a little bit less than the person, that comes in after you.
Sure.
But it's all about communication. Me and you have to communicate. And I have to know what you're feeling and what you're going through and what you're experiencing, because then I can kind of tweak and change and adjust based on that.
And do you prescribe hormone replacement therapy then for women that do have hormonal imbalances?
I do bioidentical only. So
what's the difference? So the easiest way for me to explain it is, think about it like this. It's a key that you're going to put into the door to unlock the door. Mm-hmm. And somebody gave you the wrong key. It looks very similar to the key, but it's still the wrong key. Mm-hmm. And you can put it into the lock. You just can't really turn the lock. Mm-hmm. And then when you're trying to pull the key out, it kind of gets stuck a little bit, right? And you're like, oh no, I'm going to break the key. What am I going to do? Right. So synthetic hormones are 75% of what it is that they want of this molecule. Mm-hmm. 25% is usually a filler. Mm-hmm. What is that filler? I don't know. It just depends on what pharmacy you're at, what medication it is. Mm-hmm. And that's kind of how they make it cheap, branded versus generic. Sure.
So if it's a generic, it's a little bit more filler. Maybe it's a different type of filler. So what I find is that if you're putting filler into it, you've just disrupted the molecule. It doesn't look like the same hormone molecule as your hormones. So it's a key that goes in, but doesn't actually turn. And then you're scared that it's going to break as you're coming out. Okay. So if you think about it like that, the liver looks at it and it has a really hard time processing it and kind of figuring out what to do with this thing. So that's when I'll see a lot of side effects from patients. Bloating, bleeding, acne, weight gain, all these kind of weird sensations that they have. And it's just because I'm not getting 100% of the actual molecule that I'm looking for. Whereas bioidentical is plant-based. So it's basically just yam, soy, sterols. There's no filler in it. So it actually mimics the actual key that's supposed to go into the lock. So if you're able to put the key in, you open the door, you go inside, you shut the door, everybody's happy, they do their job. That's exactly how that looks. So it's more predictable. I had a patient, it's really interesting, right before I left here, one of my PAs at the office, she's seeing a woman and she's on it's a pharmaceutical, like a CVS generic type of progesterone. She, she can't afford to do the bioidentical, although I hate even saying afford, because that's not even a thing. It's not that expensive. It's just some I
want to get into that actually. Get into your story because I definitely want to get into the affordability of each. Yeah. So finish your story and then we'll get into that.
Okay. So just to kind of like, and we can always cut this out too, because it's very sticky. But so this patient, she has Medi-Cal, and Medi-Cal is a government funded health system. Right. So she gets all of her labs covered for free, which is amazing. I can order any labs I want to, and they're covered for free. Whereas, if you're on Blue Cross Blue Shield or Kaiser, it's not like that at all. You have a copay, or maybe you have a deductible. I have to watch what I do. Sure. Or, maybe you do a cash pay because of your deductible. Right. So that stinks, that the way the system works. Yep. I really don't like that. And so for her, money is tight. And so she has to pick and choose like how she's going to spend her money. And she does pellets with us. So pellets are basically what I like to call grains of rice, even though it's actually smaller than a grain of rice. And we implant them, and that even sounds bad. I use a 3 millimeter incision, and it's in the subcutaneous tissue. And you put a little bandage over it.
Where?
So when
where are you implanting?
Usually it's about your underwear line. Okay. And when you do that, what you're putting in for women usually is just estrogen and testosterone. For men, it's only testosterone. Again, plant-based, and it's compressed plant-based. So there's nothing else in it. The way that pellets work is that every time your heart beats, it pulls a little bit from the grain of rice, as you will, and empties it into your bloodstream the way that your ovaries would have naturally released estrogen and testosterone.
Okay.
Or for men, how your testicles would have released testosterone.
Okay.
So it's a little bit more of a nicer, kind of even way of administering hormones. Now, for women, hormones, these pellets last about 3 to 4 months. For men, it's 4 to 6 months. So they'll have to come back, once a quarter. So that's, again, for women, that's estrogen, testosterone, which means that she now needs to do progesterone, because we talked about the teeter-totter, estrogen. Yeah, exactly. And so, to do bioidentical progesterone is going to cost her a little bit more. So she's already going to pay, for her pellets. So there is something called prometrium. And prometrium is, I guess, for lack of better words, like the best trying to get bioidentical in a pharmaceutical type capsule from CVS or Walgreens. Okay. But it's still not 100%. And I see that in my labs. And that's why I can say what I'm saying. But it only comes as 100 milligrams and 200 milligrams. So for this woman in particular that I'm talking about, her labs come back and her progesterone's still super low, as if she's not taking anything. And she's actually taking higher dose than what my bioidentical ladies would be taking.
Wow. Okay.
And my bioidentical progesterone ladies, their numbers are exactly where I want them to be. So what I had to explain to the PA in my office is, I know this is prime example where you see this. So we're going to have to bump up her dose to this level to kind of get her to this level. And the PA goes, oh my gosh, that's such a high dose. And I go, but it isn't, because she's not getting 100% of it.
Right. 75 max.
So it's like, yeah. So you got to think like that, so she might actually get more side effects. And so you got to tell her that. Okay. Because we are bumping it up to kind of get her to this level. She might feel, drowsiness, or like she's drugged, or she might have a dry vagina. She might have irregular spotting or bleeding or, whatever comes with that. But again, it's like, you try, it's like you're trying to help these patients as much as you can, and you do the best that you can. But sometimes it's not 100%,
So let's get back to the costs. So does insurance cover the services that you provide and the bioidentical hormones, or does it not?
It doesn't.
Ugh.
Now, yes, what's interesting is some insurance companies will cover my visit because it's just like an office visit, but I'm an out-of-network doctor. Sure. So whatever that looks like on your plan, you would have to submit to your insurance, and then they would send you a check back if they decide to or not, or whatever the case may be. They don't cover the pellets. They don't cover the bioidentical hormones. They want you to go on their patches, or, I had a lady yesterday asking about going on estradiol, like oral capsules, and, that I don't do that either. So it's so tricky. It's hard because women are trying. They really are. And they're trying to do the best that they know how with what the funds that they have. And I get it, and so I really do try to kind of help them maneuver the system. But at the end of the day, it's like our system's kind of broken. And I honestly, I don't know how to fix it.
Yeah.
I wish I did.
I wish that we had a little bit more available to us via, the insurance. And we were able to choose. And I think that's what insurance hinders us from doing, is the ability to choose our health care. So that's really unfortunate. But for the women who can't afford coming to you, right? That they're stuck with the patch and maybe a progesterone pill that they're taking. How do they know that this is working or is not working? Is it just how they feel? Or you were talking about some side effects, so can we get into that a little bit?
Yeah. So again, at the end of the day, what I'll try to tell patients is, yes, I'm a math person, a number person. So I really want to see the numbers and how they change, but you're also a human, and I need to know how you feel. Right. So if your numbers come back and they're not exactly where I would like them to be, but you tell me I'm sleeping, I have great sex, I'm, have good mood, my weight is controlled, right? Then I'm cool.
Got
You
it.
know, I
Sure.
want you to be able to live the best life that you can.
Right.
So whatever that looks like, I'm just your coach.
Mm-hmm.
I'm here to kind of give you some guidance, but at the end of the day, this is your body, your choice, your
Right.
decision,
Right.
you
Right.
know?
And just so we know, what is the average cost of a pellet?
Yeah. So women's pellets are different than men because number one, they're less, and men could take up to 10, 12, 15 pellets.
Let's talk about women.
And they last, yeah. Okay. So women, it's about $400 is what I want to say.
Okay.
It just depends on where you're going, but it could be anywhere from $400 to $500.
And that's you said 3 months?
Every 3 to 4 months.
Every 3 to 4 months.
Yeah.
Okay.
And that includes both your estrogen and your testosterone. So let's break down the math. So if we're saying $400 to $500, let's just say $400 for 4 months. That's $100 a month, and that's for estrogen and testosterone. So realistically, you're paying $50 a month for estrogen, $50 a month for testosterone.
Right.
If you kind of break it down that way,
Sure.
which when you kind of think about all the other medications that people are on, I mean, this is why I started Novus. Is I was in family practice. I've been doing family practice since 2003, so about 20 years. And what I noticed is that patients would come into the office and I would say, oh, okay, can I, what medications are you on? They have no idea what they're taking. They don't know what dose they're on. They don't know why they're taking it. They'll hold on. They take out their wallet and they bring out this piece of paper that literally looks like a scroll, and it has like 20 different pills on it.
Right.
And as I'm looking at all of them, I'm like, all right, you're on 4 different medications for diabetes and your A1C sucks. It's not controlled. You're on 4 different medications for your blood pressure and your blood pressure is not controlled. You're on 2 different medications for cholesterol and your cholesterol is not controlled. You're on a medication for your osteoporosis because you're on omeprazole for your GERD, but you're on omeprazole for your GERD because of your statin. Then you're depressed, so now you're on an antidepressant, anti-anxiety. Now you're not having sex, now you're on Viagra. It's like, can we stop?
Right.
You
Right.
know?
Absolutely.
And that's, I couldn't, I was like grossed out by this system.
Yeah.
And I remember just taking a step back and I was like, I can't add another pill to you. I'm just making everything worse.
Right.
So I kind of want to start over. And that's what I did. I took select patients and I just started removing medication from them. And I said, we're going to do this together. You're going to come in every single week. You're going to come in with your diet menu, your journal. I'm going to have you check your sugars twice a day. I'm going to have you check your blood pressure every day. And you're going to walk every day. And I'm going to see you every week just to monitor you.
Right.
And before you knew it, I would say like 6 weeks in, 8 weeks in, these patients were actually getting better. They were sleeping, their sugar was more controlled, their blood pressure was controlled, they were losing weight, they were happy,
Amazing.
They were having sex. And you're like, what is this? Like, why are we, this health that we have right now is not health. It's, reactive. We're not being proactive.
Right.
And, it kind of took that for me to decide, I need to do a little bit more for my patients. And that's when I became hormone certified, peptide certified, and started bringing that into the practice. Well, I kind of tell this story that I went away for a week on vacation, and I was having these patients come in every week. So I said, you'll be fine. There's I had 4 other practitioners in the office, and I was like, somebody will see you, they'll go through, like, don't worry about it, I'm only gone for a week.
Right.
So I come back and all the physicians sat me down and they go, you cannot be doing what you're doing here. You just took off everyone's statins, you took their aspirin off, you took their metformin off. We don't do that.
Wow.
And then I had one practitioner say to me, we are not in the business of fixing patients. If you fix them, they don't come back. Yeah.
Yeah, we're in the drug peddling business. That's where we're into. We're drug dealers.
Yes.
Oh my
gosh.
Right.
I went home and I cried.
Gosh.
And at that time, I was still married to my husband, and I was like, I guess I'm just in the wrong field. All my life I've ever wanted is to help people.
Right.
I've always wanted to be in the medical field, helping people. And if this is what it is, I'm not helping people, I'm actually hurting them, then I guess this isn't the field I'm supposed to be in.
Right.
And at the time, he was in advertising and marketing, and he was like, you know what, Stephanie, why don't you open up your own clinic? I'll help you. Like, these patients will come and you can do it the way that you want to do it.
Amazing.
And I remember I was like, nobody's going to come see me.
Who want to come see me?
Who's going to see me?
Wow.
And so we started Novus actually in our living room. I started seeing just friends, referrals of friends, and it was on the weekend. And it got weird because I have kids, and they would have sleepovers. Lack of HIPAA. Right. And so then, I ended up renting this back house in Toluca Lake. It was a guest house. It was a 2-bedroom, 1-bath guest house, and was seeing patients there, and it got weird again for the poor woman.
Right.
And so then that's when we got our brick and mortar, where we're at today. And that was 2017 when we opened up there.
And where are you at today?
I guess people came. I'm in Studio City.
Okay, great. But before we
Studio
say
City,
goodbye,
California.
I want everyone to know where to find you. And I have one final question for you. Again, for women that can't afford to see somebody like you, right? They're relegated to the synthetic hormones. What is your stance on hormone replacement therapy and the increased risk of cancers? Because there is a lot of conflicting ideas out there, and I just wanted your take on it.
Yep. I do believe that you do see it more when you are using the synthetic, because that's how your body is breaking it down. But I always post this question to women. If you think about it like this, most women have their highest, best amount of hormone in their 20s and when they're pregnant. How many women in your 20s and while they're pregnant do you know have breast cancer, ovarian cancer, uterine cancer, cardiovascular disease from their high hormones?
Right. Not a lot. Yeah.
I'm just asking a question.
Right.
Is all.
Right. Okay, that makes sense.
And same goes for men. How many men do you know in their 20s have prostate cancer from their high testosterone levels?
Right.
So
okay. There's interesting.
Something we're missing.
Yes.
Yeah.
So Stephanie, tell us where we can find you and the services that you can provide for the people that live in this area, in LA Metro area.
Yeah. So I'm in Studio City, California. We're just off of Colfax and Riverside. And we see men, we see women, all ages. I mean, I see teenagers too.
Yep.
We also do shockwave therapy for the treatment of erectile dysfunction, Peyronie's disease, sexual performance. We do PRP treatments, stem cell exosome treatments. We just got a Morpheus 8 machine in so that we can start working on the ladies and their vaginas
I know all about Morpheus.
And their skin. Yeah, so we do a lot of fun stuff at the clinic.
And what is the name of your clinic?
It's called Novus Anti-Aging Center.
Okay, great. Stephanie, thank you so much for your time. Really dropped a lot of knowledge on us, things that we can take back that would help us women perform our best, because I think that's what we really don't talk about. We talk about being great at your job or whatnot, but if you're not feeling good, you're not performing at your best in anything that you do. And you've really opened our eyes into how that happens and how we can help women going forward. So thank you for coming on, and we look forward to having you on again.
Yeah, thank you so much. And I want women to realize you don't have to suffer, and you can actually be a badass as long as you possibly can be a badass.
Couldn't have said it better myself. Thank you, Stephanie. Thank you for coming on. Have a great day.
You're welcome. Right. You too.
Bye.
Bye.